Hello, everyone. Welcome to our week 7 assessment for module 4. This is actually week 37. So congratulations for those who have stayed with us. And we hope that we can reach the finish line. I'm very confident naman you will all make it. No? So today, we shall be focusing on two channels, the heart channel of Han Shaoyin and the small intestine channel of Han Shaoyan. Okay. So as usual, we will have to review the pathways. So first we have the primary pathway or the primary channel. Okay. So the channel, the heart channel will actually begin in its own organ, no? The heart. And then it will travel downward across the diaphragm where it connects with the small intestine. So we all know that the heart is the exterior-interior partner of the small intestine. A branch of the main channel separates in the heart and ascends alongside the esophagus to the face where it joins the tissues surrounding the eye. Okay. Then another branch goes directly from the heart to the lungs. Okay. So it goes to the lungs. Then it slants downward to emerge below the axilla. From here, the channel descends along the medial border. So we have so far discussed the two branches, no? So from here, the channel will descend along the medial border of the anterior aspect of the upper arm to the antecubital fossa, where it continues downward to the capitate bone, proximal to the palm. It then enters the palm and follows the medial side of the little finger to the fingertip. So the heart channel directly pins the lungs and kidneys. Kaya huwag kalimutan parate yung lungs and kidneys. Okay? So what is the clinical importance of knowing the primary channel? So we will be able to determine whether the signs and symptoms are exterior or interior. So pag exterior, there is general fever, headaches, pain in the thorax and back. So if you notice, this actually has something to do with the course of the primary pathway, thirst with desire to drink, heat sensations in the palms, cold invasion in extremities, pain in the shoulder, and medial aspect of the arm, upper arm. So it's mostly the primary channel. And also, pag interior, that means the Zhangfu organ is affected. So you'll have heart pain, pain and fullness in the thorax and the lateral costal region. There will also be hypochondriac pain. Remember, it has a connection with the lungs and kidneys, no? Irritability, shortness of breath, restlessness, dizziness, and mental confusion. Next, we go to the luo connecting channel. So the luo channel separates from the channel at heart 5. Now, we all want you to remember heart 5. You will understand why later, and it's so effective. So it separates from the channel at heart 5, and it connects with the small intestine at SI4 at about 1.5 soon above the transverse crease of the wrist. The channel again separates from the small intestine channel and follows the heart channel to the heart itself. It then proceeds to the base of the tongue and connects with the eye. Okay? So meron talagang connection sa tongue and eye ang heart channel. So that's actually the luo channel. So what is the importance? We would be able to determine whether the pathology is excess or deficient. So we consider it as excess if there is distension and fullness of the thorax and diaphragm, deficiency if there is aphasia, okay, and disorders of the vocal cords. Next, we go to the heart divergent channel. It diverges from the primary channel at the axillary fossa. So look at your axillary area. Okay, so that's divergent. Okay, and it enters the chest, and again, it connects with the heart. It then ascends across the throat, and then it emerges on the face, joining with the small intestine channel at the inner canthus. Okay, inner canthus. So what is the importance of knowing the divergent channel? It strengthens the relationship between the heart and the thoracic region. So that means points on the heart primary channel mainly treat disorders of the heart and thorax. There is no connection with the small intestine. Okay, so with regards to the divergent channel, okay, another clinical importance would be it connects the heart primary channel with the neck. Points on primary channel can be used to treat disorders of the throat and vocal cords like laryngitis, pharyngitis, and we have to use points such as heart 5 and heart 8. So the heart divergent channel strengthens the connection between the heart and the inner canthus of the eye. So heart points can therefore be used for eye disorders. Okay. And lastly, we have the heart sinew channel or the heart muscle channel. So it originates, as you can see here, on the medial aspect of the little finger. It connects first with the pisiform bone of the hand, and then again at the medial aspect of the elbow. From here, the channel proceeds upward and enters the chest cavity below the axilla. It crosses the lung muscle channel in the breast region and connects in the chest. Descending across the diaphragm, the channel connects at the umbilicus. So again, what is the clinical importance? Okay, for pathology, if we consider the sinew channel of the heart to be involved when there is stiffness, cramps, and pain along the pathway of the heart sinew channel. So you have to be familiar with the heart sinew channel. Internal cramping in the cardiac region, for example, disorders with angina-like pain due to stress, hiatal hernia, and disorders of the stomach. So what is the indication for the heart sinew channel? Mainly for painful obstruction syndrome or the P syndrome along the pathway of the heart channel. Okay, the area covered by the heart sinew channel is larger than that covered by the heart primary channel. So this explains why the heart primary channel points can also be used for disorders and diseases of the thorax and chest. For example, if there is pain and tightness in the chest, mastitis, and mastopathy. Since the heart sinew channel also penetrates the diaphragm, it is also indicated for hiccups, acid reflux, esophagitis. Due to its connection, if you remember, with the umbilical region, the heart sinew channel also has a direct link to our yuan qi, the original qi. If the heart shen has suffered a shock, for example, due to fainting or collapse, we can do direct moxa at REN 8. Okay? Yon. Okay, so tonification point is heart 9, sedation point is heart 7, Harari point is heart 8. And we treat most emotional disorders except for anger. Mental aberrations are treated as well, like amnesia, delirium, hallucinations, madness. So for actual heart problems, we tend to use the pericardium channel more. Okay, all the points of the heart channel, there are just, a very few of them. They work for palpitations, anxiety, nervousness. Okay, so heart 3, we use this for numbness, shaking, and trembling. Heart 5 for bradycardia, that means like slow down your heart rate, and also stuttering. So that's very heart deficiency. Heart 6 for night sweats. Heart 7, which is a master psychological point. I'm sure you're very familiar with heart 7. It's very good for insomnia, nervousness, anxiety, depression, neurasthenia. Heart 8 for actual heart problems. Okay, So for those people with actual heart problems, you try to palpate this point, you will notice some tenderness. Okay. Also, when you have rheumatic disease and also congestive heart failure, urinary disorders, itching. Okay. And for heart 9, we use this as a revival point and also for heart problems. Okay. Let's call on the first one na dumating. Ma'am Angel, good evening. Can you... Okay,
Good
again,
evening po, Doc. Good
yeah, may mga
evening, classmate.
answers. Yeah, may mga answers dito na wala ang sagot, no? So, it doesn't necessarily mean na lahat mag-match. If you notice, there are only like seven options, no? 7 choices, and there are 9 items. So I'll give you a clue. 2 items do not have a match. Okay, kaya nga 7 lang. Okay, can you take
Okay,
your
Doc.
1 to 9, Ma'am Angel?
Noted po.
Okay, good.
Yes po.
Start with heart 1.
So, part 1 po is, may answer po is letter G. Arthritis of the shoulder, excessive perspiration po.
Very good. So the answer is G.
Letter
Number
G
2.
po. Number 2 po, heart 2. So, si heart 2 po ay, Doc, ay isa po siya sa no answer.
Yeah, none. Very good.
Yes
Kasi
po.
we don't usually use it. So wala siyang
Yes po,
sabi
Doc.
masyado. Very good. Heart
Opo.
3.
Heart 3 po, Doc, is, may answer po is letter B. For depression, agitation, nervousness, numbness, trembling, and shaking po.
Okay, how do you classify heart 3?
Heart 3 po, classification po niya is HESI point, water.
Okay, water point. Very good. Next, heart 4.
The number 4 po, Doc, ay isa rin po siya sa no answer po, Doc.
Wow, ang galing. No answer.
Yes po.
Yes. Okay.
Yes
So
po, Doc.
hindi masyadong sikat si heart 2 and heart 4. Let's go to heart.
Yes po, Doc.
Very, very popular.
Yes po. Si heart 5 po is a luo connecting point. Answer ko po is for palpitation, letter A. For speaking difficulties and bradycardia po.
Very good. So nakita nyo kanina sa luo connecting channel ng heart, si heart 5. Good. Number 6. Heart 6.
Okay. Number 6 po. Number 6 po, heart 6 is Shikla point, and my answer po is letter E for neurasthenia, night sweat, and TB.
Yeah. Actually, maganda din siya sa mga blood issues, no? Di ba pag she cleft, like TB, di ba merong hemoptysis, umuubo ng dugo ang mga may TB, no? So napakaganda ng heart 6. Night sweating especially. Number 7. Before we continue.
7 po, Doc. Heart 7 po.
Yeah.
Yes, Doc.
Let's go back to heart 6 first. I'd like
Yes,
you to be very familiar with patients who present with yin deficiency. Usually mga payatot sila, hindi talaga sila tumataba, and they look so like malnourished. Diba nakita niyo yung mga may TB. So, and then if you look at their tongue, so in fact when you say yin deficiency, kulang talaga silang nutrition, kulang lang yin. Kaya yon, meron silang night sweats. Okay, neurasthenia. Yeah, sorry about that. Number 7.
Okay. Number 7 po, Doc. So number 7 it is heart 7. Classification is Shoestream, earth po siya. And then also Yuan source point. Tapos may answer po sa kanya is letter C, insomnia, anxiety, absent-minded, mindedness, and epilepsy po.
Yeah. In fact, when I was starting with ACU, hindi ko talaga kinalimutan yung heart 7. It actually helps you remember things. So maganda siya for students to sharpen their memory, for them to not be able to forget their lessons. Heart 7. Number 8, heart 8.
Number 8 po, Doc. Heart 8 po is Ying Spring Fire.
Okay, very good.
And may answer po is letter F, rheumatic heart disease, angina, arrhythmias, and itching.
Okay, very good. Correct.
So letter F po, Doc, ang answer.
And finally, I'm sure na perfect mo to. Heart 9.
Heart 9 po, Doc. Jingwell po siya. wood ang element. So, heart 9, my answer is letter D. Tonification point po siya, Doc.
Okay, very good. Congratulations. Excellent job. Thank you po. Keep it up. Keep up the good work. Thank you. Okay, sino pong gusto from 10 to 15? Can I call on? Let me see. Miss Angelita Ramos? Ready? Nag-aral ka ba, Ma'am Angelita?
Medyo, Doc.
Ano medyo?
Pero
Dapat,
nag-aaral, Doc, kaso nga lang, syempre, ang hirap, Doc.
sige, pakita. Ano
Kaya
yung hirap?
patigil-tigil.
Dami nyo nang reference. O sige, go. Number 10.
Okay, Doc. Number 10, which point clears damp heat in genitals, Doc? Ang answer ko po is heart 8, Doc. Tama ba?
Do you agree? Does anybody else have another answer?
Or heart 5, Doc?
Ano kang heart 5? Chi deficiency. Take note ha, maraming heat, nangangati.
Or
Ano ba
itchiness,
gagawin mo
Doc?
pag masyadong, itchiness yan, damp heat. Diba? Damp heat.
For itching, Doc, di ba heart 8? Mali ba?
Partly ko like yung heart 8, pero alin sa palagay mo ang mas effective? Heart 8 or heart 9?
Okay, Doc. Hindi ko anong heart 9, Doc. Heart 9 is one source, Doc.
Do
At
you
saka,
agree? Does everybody agree? Jing, anong yung one source ang heart 9? Ikaw talaga? Anong libre yan? Heart
ay, sorry,
9.
Doc. Heart 4 pala yan.
Huwag ka na ma-tense. Alam naman nila magaling ka. Okay, go.
Doc, ang mas for clear damp heat, Doc, is heart 9. Tama
Yeah.
ba, Doc? Sabi niyo. Okay,
For
Doc.
heart fire kasi,
Ino-note ko lang.
I'm not so sure ha. Ako kasi pag heart fire, I use heart 8. Do you all agree? Di ba heart 8 and pericardium 8? So, yung mga talagang damp heat, kating-kate, nakaka-stress kaya yan, no? Okay, I'm sure yung iba dyan, ano to. So, heart 9. Okay, number 11, Ma'am Anggita. Pakyawin mo na.
Which point does not pull heat?
Ay,
Doc,
may
heart
comment si
9.
Ma'am Lynn. Okay, we're open for
Question ko
comments.
lang to kasi parang may nabasa po ako na yung heart 9 for heat in the upper burner. Tapos heart 8 for heat on the bladder and small intestine. So mas lower burner na heat yung heart 8. Tapos yung heart 9 for upper burner na heat.
Lower burner, yung heart 9.
Heart 8 po, ang lower burner. Heart 9 for upper burner. Kaya yung answer ko din heart 8.
Let me see.
Yes, Doc.
I-google natin.
Heart 8 din.
I might be
Kasi I
wrong.
read somewhere na for damp heat, for mas maganda siya for genital concerns yung heart 8 po.
Ganon. Ako, I use kasi heart 8. I'm not
lower.
sure ha. I might be wrong. Does anybody have... Okay, for heart fire, alam ko heart 8. Hindi ka naman magkaka-heart fire ka agad pag... And when you talk about the lower burner, hindi naman puro... Actually, nakakamot na... yeah, sabi din ni Ma'am Angel, buti may kakampi ako. Thank you. Okay, tinan natin na baka mali kaming dalawa ni Ma'am Angel. Saan mo nakita yan? Basta alam ko, we don't use heart 8 for damp heat, for genitals.
Hanapin ko doon yung reference pa. Basta nabasa ko siya, heart 9 for upper burner na heat. Tapos heart 8 for lower burner.
Sige, we'll go through it. Mukhang mahina lang yung internet ko. Mukhang ayaw yata magpa-Google. Sige, okay, does anybody else have another, Okay. Okay, sige, heart 9 or heart 8. But ako kasi, I prefer to use heart 8 for, heart 5.
Okay.
And heart 5 kasi is more intense eh. Diba? Mas grabe siya, yung spring. So, and usually pag may bitter taste, I don't think meron ka na kaagad bitter taste pag meron kang damp heat lang in the genitals, di ba? So, hindi pa masyadong, hindi naman ito fire, damp heat lang yan. Okay. Okay, number 11, Ma'am Angelita, what is your answer?
My answer, Doc, is letter C, heart 4.
Okay. Ano ba yung heart 4 na yan? Can you tell us about heart 4? Hindi siya masyadong popular, no?
Yes,
Okay.
Doc. Wait lang. Yung
Yung iba,
aking source is...
can you
Yes,
tell
Doc.
us, ano po ang gamit ng heart 7? Like, kasi syempre nagko-cool siya ng heat. What kind of heat are we talking about? Heart 7?
Heart 7 is for Shenmen, Doc, di ba po?
Yeah, Shenmen, pero when do you usually use it? To calm the mind, di ba?
Yes, Doc.
Shenmen, spirit gate. Pero between heart 7 and heart 6, ano ang kakaiba? Kailan mo gagamitin si heart 6 and si heart 7?
Heart 6, Doc, gagamitin, Doc. Kapag ano, Doc,
Heart
same din po siya, is for anxiety din po siya, di ba, Doc? Yung heart 6. Shake left point po siya.
Okay, ako kasi like wala pala si heart 5. Heart 5 kasi is for heart chi deficiency. So heart 9, alam naman natin it can revive, no? And ano siya, Jingwell. Okay. So heart 4 is the correct answer.
Heart 6 for deficient heat, no?
Yeah, deficient heat ang heart 6.
Deficiency for high
Deficiency heat.
Yeah, kanina lang yan diniscuss, di ba? Night sweats.
Yes, Doc. Night sweat.
Okay, next, Ma'am Angelita. Di ka pa tapos, Ma'am Angelita.
Yes,
Pakialam
Doc.
na yan. Which point is best used to tonify or sedate the luo vessel symptoms? By the way, what are the symptoms of the luo vessel? Let's go back, ha? Luo.
Doc, in TCM, Doc, in deficiency, tonify the source of deficiency channel and disperse it. For excess din, Doc, for disperse the source of excess channel, Doc. At saka tonify.
Okay, what exactly does a luo connecting channel do? So, ibig sabihin, pag tinonify mo si yin, maapektuhan si yang, which is the small intestine. Diba? Like, pag may... Okay, let's go back to ano, ha? So, what's your answer here, Ma'am Angelita? What point?
Heart 7, Doc.
Are you sure?
Hearts not, Doc.
Where does the luo connecting channel? Okay, do you remember this? Kailangan memorize niyo po ito. Obvious naman yan, di ba? Oh, nag-separate ang luo channel from
Heart 5.
heart 5.
Yes.
At siya parang, you know,
okay, heart 5 na.
heart 5. Nandiyan na siya, oh, heart 5. So the answer should be heart 5. And what are the symptoms of luo connecting vessels? So pag excess, may distension and fullness of the thorax and diaphragm. May medyo bigat yung pag ano mo, like sa chest. Pag deficiency, aphasia, you cannot comprehend, you cannot actually speak out what you want to say. Yan ang aphasia. So that's very difficult. And also when you have disorder of the vocal cords, which actually is the reason why we can talk. So pag mahina po yun, yung deficient siya, hindi ka talaga makapagsalita. So that's very low. So the best point would be heart 5. Okay? Okay, so you have one mistake. Let's go to number 13. Which point is also useful in urinary?
Which point is also? Doc, ang sagot ko yan, heart 5 ko, Doc. Mali.
So mag-isip-isip ka. Pag masyado, 'di ba, urinary disorders is actually small intestine. So ang tanong ko, pag masyado ng, you know, yung pag-ihi masyadong mainit, no? So grabe yung fire niyan. So what do you think is so you will have to deal with something, a point that is very useful for heart fire. And what is that point? Which we just mentioned a while ago. But din siguro, no? Okay. What's your answer here? Heart 8 or heart 5? Ma'am Angelita,
So,
nawala ka na.
Dok, kung mali ang heart 5, heart 8 siya, Dok.
Siyempre.
Kasi for urinary disorder din siya, Dok.
Okay. Sige,
Sorry,
very...
Dok, may nakita lang po akong heart 5 for urinary. So, heart 8 din.
Usually yung umiihi ng mainit, yung parang ano. Basta small intestine, pag small intestine na affected, ang kapartner yan ni heart, di ba? So, maganda dyan is heart 8. Number 14, what is your answer, Ma'am Angelita?
Heart 7, Dok, for insomnia.
Wow, your favorite.
Yes, Dok.
Okay, number 15.
Young, Dok.
Ay,
Heart 7 din, Dok.
before we continue, anong klaseng, okay, sabi mo the best for insomnia. So, ibig sabihin, may mga ibang points maganda for insomnia. So, ang tanong ko, anong klaseng insomnia gagamitan mo ng heart 6? Sinasabi dito, best sinasabi na for, ibig sabihin, there are other points na effective din for insomnia. The best lang is heart 7. Pero kanina, we made mention about heart 6. Do you think we can also use this for what type of insomnia?
Dok, ito siguro, Dok, yung pagising-gising, Dok.
Ang galing naman. Grabe.
Kasi night sweat, Dok, eh.
Oo. Okay, galing. You know, nag-transform ka na talaga, Ma'am Angelita. No, you might top even the
Thank you,
exam.
Doc.
Okay. Sana masanay
naman,
kayo, ha? Kasi,
Yes, Doc.
ano, number 15.
Doc, which point has a specific function for the young? Heart 7 pa rin, Doc.
Bay, bakit? Nakakatulog na nga si heart 7. Gagamitin mo siya for young. Pampagising, di ba?
Pampagising, Doc.
Baka hindi na magising. Isip-isip mabuti. Ano ba yung ginagamit natin na point para magising?
Heart 9, Doc, for revival point.
The answer should be heart 9. Thank you very much, Ma'am Angelita.
Yes, Doc. Thank you.
2 mistakes, 2, but good enough. Congratulations. Keep up the good work.
Thank you
po.
Yes, Doc. Yes, Doc.
Okay, so now we proceed to another channel, the small intestine channel, Taiyang small intestine channel. Okay, saan nag-uumpisa si small intestine, the primary channel? Okay. Nag-uumpisa po siya. O tinan niyo po yung inyong little finger. Nag-uumpisa siya sa ulnar tip, ulnar side ng tip, no? Tip of the little finger, ulnar side, and then umaakyat siya along the ulnar side of the hand to the wrist, and then it emerges at the styloid process of the ulna, and then it goes directly upwards. It goes directly upwards along the posterior aspect ng ulna. You should know where the ulna is. So, by the way, we will have surface anatomy next year, by January, hopefully. And it goes directly upwards along the posterior aspect, and it passes between the olecranon of the ulna and the medial epicondyle of the humerus at the elbow. And then it proceeds along the posterior border of the lateral aspect of the upper arm, posterior sa likod, and then emerging behind the shoulder joint, and then circling round the superior and inferior fossa of the scapula. At the top of the shoulder, it crosses the bladder channel at points bladder 41 and bladder 11, and the do channel at do 14. Okay? Kaya dito talaga nag-uumpisa. Alam niyo yung connection niya, no? and where the channel will turn downward into the supraclavicular fossa and connects with the heart. Dito na. Can you follow? Okay. From here, it descends along the esophagus, okay, and crosses the diaphragm to the stomach. Dito po yung esophagus. Nasaan po ba yung esophagus? Nasa front or nasa likod? Alam nyo yan dapat, ha? Okay. So it descends along the esophagus, crosses the diaphragm to the stomach. So umaabot na. Before reaching its associated organ, the small intestine, the small intestine channel intersects the conception channel internally and very deep at points REN 13 and REN 12. So a branch of this channel travels upward from the supraclavicular fossa and crosses the neck and cheek to the outer canthus of the eye, where it meets the gallbladder channel at GB1. Remember GB1? Then it turns back across the temple and enters the ear at SI19. Another branch separates from the former branch on the cheek, and then it ascends to the infraorbital region of the eye and then to the inner canthus. So nakapalibot siya. Okay, dito naman sa inner canthus, the SI channel will meet with the bladder channel at bladder 1, remember? And then it crosses horizontally to the zygomatic region. Another branch will descend down to the stomach 39, the lower husi of the small intestine. This channel connects with the heart and directly joins the stomach. So that's the small intestine. Okay, ano po importance of knowing the primary channel of the small intestine? Again, we can differentiate between exterior and interior. Pag sinabi mong exterior, yung mga pinagme-mention natin kaninang dinadaanan, no? So there will be mouth and tongue ulcers, cheek pain, neck pain, occipital stiffness, pain on the lateral aspect of the shoulder and the upper arm. So basically, it's channel involvement. Pero pag interior po, affected na po yung Zhangfu organ mismo. So there will be pain and distension of the upper abdomen, radiating to the genital region, diarrhea, epigastric pain with constipation. Next, we go to the luo channel. So tandaan nyo po ito, SI7. So after separating from the primary channel at SI7, small intestine 7, nagko-connect po si SI channel with the heart channel at heart 7. Okay, SI7 nagko-connect siya sa heart 7. Another branch will continue up the arm, crosses the elbow, and then joins with the shoulder. So, what is the clinical significance of this? Okay, pag excess yung SI, the joints are weak and unstable, and there's also paralysis or weakness of the elbow and the arm. Okay? Pag deficient po ang SI, meron kang mga warts. So if you would like to get rid of the warts, you know what channel to tonify. So you will have to tonify specifically the luo connecting channel. Okay? So, yung mga merong ano dyan, yung mga nakaka-relate, no? Warts. Yon. I hope that made sense. Now we go to the divergent channel. Okay? So, after separating from the primary channel of the shoulder, this divergent channel will enter the axilla. Okay? And then it crosses the heart and descends to the abdomen where it connects with the small intestine. That's the divergent channel. So axilla again. Clinical importance, it strengthens the relationship between the heart and small intestine. So this has something to do with the Zhangfu. Provides explanation for the pattern of heart fire transferring to SI and bladder. So yung mga medyo ngayon lang nalaman, be it known na if you have urinary issues, it always involves the heart, too much heart fire. So ano ba tawag dito? tumatapon sa small intestine. And syempre partner ni same polarity po ang SI and bladder. Okay? So yon. So that means you just don't treat the bladder, you have to treat the small intestine. So particularly the divergent channel of the small intestine. And finally, we have the sinew channel of the small intestine or the muscle channel. So it begins at the dorsum of the little finger, sa likod ng little finger, and then nagko-connect sa wrist and ascends along the forearm to the elbow, where it connects with the medial condyle of the humerus. From here, the channel proceeds up the arm and connects below the axilla. So a branch travels behind the axilla, surrounds the scapula, nandito po, and follows in front of the bladder muscle channel on the neck, okay, connecting behind the ear, okay? A branch separates behind the auricle and enters the ear itself. After emerging above the auricle and the branch descends across the face, and then it connects beneath the mandible, the lower jaw. Then it ascends to connect at the outer canthus and the temple. Another branch separates at the mandible, ascends around the teeth and in front of the ear, connecting at the outer canthus and the angle of the natural hairline. So anong importance po nito of knowing the sinew channel? Pag may pathology, meron po tayong distending sensation. Parang lumulobo, no? Stiffness and pain of the little finger, impaired range of motion of the upper extremity and shoulder, pain, stiffness, and impaired range of motion, or impaired ROM of the cervical spine and occiput. Tinnitus and ear pain radiating to the mandible. Indication, mainly, so just like the heart sinew channel, ang SI sinew channel is also for P syndromes, no? Along the pathway of the SI channel. The area covered, as you can see, by the sinew channel is actually larger than that covered by the SI primary channel. So this explains why yung mga points na nasa SI primary channel can be used for disorders and diseases of the cervical and thoracic spine and the whole face. For example, pag meron kang frontal and lateral headaches. Okay? So tonification point, SI3, so very easy. Sedation point, SI8. Horary point is SI5. SI1, this is the point we use for the breast, also for headaches, and when there is involvement of the eyes and mucous membranes. No? Okay, so the SI3 relaxes the muscles, also good for neck and back pain. This is also a favorite point. This is very effective, especially for upper back pain, no? Arthritis and joints, headaches also, spirit point. SI6 is similar to SI3. We also use this for neck and back pain, also for vision problems and red eyes. SI7 for lifting the spirit for those with depression and anxiety. SI17, sore throat and tonsillitis. SI19 is a local point, can be used for lifting the spirit and also when you have ear problems. Okay? So let's call on who would like to volunteer. Let me see. Sinong nakapag-prepare dito ng mabuti? Can I call? Sino ba tinawagan ko last time? Wait lang. Would you like to volunteer, Ma'am Ami? Ma'am Ami Glorioso?
Yes, Doc.
Okay, did you?
Okay, Doc.
I think this is very easy.
Yes, Doc.
Okay.
Try lang Doc uli. Number
Bawal
one.
magkamali daw.
Apo, sige, Doc. Number one, Doc, SI1. Yes, Doc. My answer, Doc, is letter B. Disperses wind and heat mastitis. Ano po ba?
Ano pong classification niya, ma'am?
Gingwell point of SI po.
Okay. It is also
Pink
known
one.
as what element point? SI1.
SI1.
Why is it very effective for mastitis? Remember, meron tayong horary point, meron tayong metal point. Remember,
Metal
yung
point po siya, Doc.
ano po?
Yes, metal point. Metal point po ng SI.
Okay. Very good. Galing niyo talaga. Okay, SI3 po.
Ang SI3 po, Doc, ang my answer, Doc, is letter D.
Okay.
Open governing channel, malaria, seizure, night sweat,
Okay. So,
stiff neck, low back pain.
confluent point po siya ng governing channel. Sino pa po ang point na, di ba dalawa yung confluent points ng do channel or governing channel? Aside from SI3, sino ka-partner niya po? Of course, dapat young point din. Sino bang
UV62 po.
Ay, ang galing. Grabe. Bladder 62.
Yes po.
Wow. You're so prepared. Okay. SI6, ma'am.
Number 3, SI6, seek that point. My answer, Doc, is letter G.
Okay.
Relaxes sinus, clear channel.
Is this also a horary point?
Yes, Doc.
So horary
Horary.
point, ibig sabihin, far point.
Horary point also.
Okay. Okay. Sure.
Tama po.
Okay. Far point ba si SI6? Far point of the fire.
SI.
Fire channel. Fire. Diba? Fire. Okay. Number 4, SI7.
Ang SI7 po is blue connecting point. My answer, Doc, is letter C.
Ang galing.
Induce perspiration, wake the spirit, and neurasthenia.
Okay. Ibig sabihin,
Neurasthenia.
yeah. Okay. Okay. Yun. So may impact siya sa heart, di ba? So if SI7 is the low connecting point of the SI, sino po ang low connecting point ng heart channel?
Low connecting point ng
Kanina lang yan.
low connecting po is
So alam na natin.
heart 5, Doc.
Okay.
Heart 5.
Okay, dapat bilisan mo next time ha. Automatic na yan.
Yes, Doc.
Huwag ka
Nakaka-tense kayo, Doc eh.
Ay, grabe naman. Dapat masanay kayo.
Apo.
Galing nyo naman eh. Huwag kayong matense. Masanay kayo
Yes,
pag
po.
sumasagot ng... Alam ko, pag na-tense ka kasi nawawala. Masanay kayo
Apo,
sa
Doc.
tension.
Totoo po yun. Nakaka-mental block. Number
dapat
5
masanay
po.
na kayo hindi na may mental block. Okay?
Apo. Number 5 po, Doc.
SI10.
SI10. Meeting point with bladder channel and the young Maymay. Ano po siya, Doc? My answer, Doc, is letter F.
Okay.
Moves chi and blood.
Okay. Yeah, letter F. SI15.
SI15, Doc, is wala po siyang categories. SI15.
Anong resulta ng research niya about SI15?
SI15, Doc, is letter A.
Okay.
Clear heat and phlegm in lungs. Heat and phlegm in lungs, clear vision, stiff neck, pain in back and shoulders. Ano po siya?
Paano siya naka-apekto sa Okay.
maano po siya, Doc, good for cutting of blood.
Okay.
Hemoptysis po.
Okay. SI19, finally.
SI19 po is the meeting point with triple burner and GB channel. So my answer, Doc, is letter E. Benefit the hearing,
okay.
calm the
Can you
spirit.
tell us the 3 points na favorite natin to treat tinnitus and deafness? And SI19 is one of them. Can you mention the other 2 points? Alam mo yan. Di ba yung tatlo, pinapabukas mo yung bunganga?
Ang SI19 po, yung pag binukas po yung bunganga, di ba, Doc?
Oo, pero may dalawa pa.
TE21.
TB21.
Mhm.
And there's another one. There are 3 of them eh.
And
Di ba tinanong na natin?
TE17.
I'm sorry? No. Sinong gustong sumagot?
GB2.
GB2, gallbladder 2. Okay, Ma'am Angel, can you mention the 3 points that we always ask the patient to open the mouth and then syempre i-close para mabilis mo i-locate. What are the 3 points? So one of them is
3 points po.
Yeah.
Apo. Yung para po sa tinnitus, Doc, is
Yeah, ano po yung tatlo?
SI19, Doc. SI19, GB2, and triple burner 21 po.
Very good. Okay, galing. Thank you very much, Ma'am Ami. Good job.
okay,
Excellent
thank you,
job.
Doc. Okay,
Ay,
po.
may comment si Ma'am Lynn.
Doc, yung SI6, hindi po siya horary point. Kasi ang fire point ng SI is SI5. SI6 is the she cleft point.
Okay.
Pero, Doc, yung ano ko rin po yung horary point din po is SI6 eh. Na-search ko rin po.
Di ba ang fire
SI6.
point?
Okay, wait
Horary
lang.
point ng
SI7
Di ba
ba?
fire?
Ano bang
Horary ba?
horary
Ang
point ng SI?
5.
Di ba fire point? Di ba SI5?
SI5.
So, hindi siya horary point. Question mark nga eh. Siguro kasi magkalapit. Kaya naka-question mark. Pwede siya maging horary
Pero,
point, hindi. Okay?
she cleft point po siya, Doc, yung SI6.
Yeah, that's why it is good for
Pero lumalabas din sa akin horary point SI6 din eh. Pero ang ano nga po, C cleft point is
SI6.
heart
SI6.
6.
Sino si
SI?
SI7?
Glue connecting.
No connecting ang SI7.
Okay. Grabe, ang
SI7.
gagaling nyo. O sige, kaya nga naka-question mark yan eh, horary point. So, ibig sabihin, pwede rin siya maging horary point kasi magkalapit lang siya. Yeah.
Okay.
Kaya naka-question mark. Okay? Thank you po. Thank you very much. Thank you for bringing that to our attention. Lahat po tayo dito pare-pareho nag-aaral ha. Okay. So, can I call on... Thank you very much po. Congratulations. You did well. Okay, let's call on Ma'am Annalyn, straight from Bicol. Na talagang... Ma'am Annalyn,
Yes,
I'm
po.
sure you're
Yes,
ready.
po. Apo. For number 8 po, the horary point is the small intestine 5. So,
Yeah.
the
SI5,
gingiva.
hindi SI6. So, pwede rin siya maging SI6.
Apo. SI5.
Yeah. Kasi ito po yung fire point ng fire element, di ba? SI5.
Apo.
Very good.
Yes, po.
Yes. Luo point.
SI7 po.
Ang galing. What are the 2 window of sky points? Before you answer that, ano pa yung window
po.
of sky? Bintana ng ano?
Yes,
ng
po.
kalangitan. What do
Opo.
you mean by window of sky?
So, pwedeng mag-disperse siya ng heat and wind. So, mag-dispel. Parang magbibigay ng kaliwanagan.
Ifa-facilitate niya yung ascending and descending. So,
Opo.
ang gusto natin
Yes.
mag-ascend yung clear, yung
Opo.
magdi-descend katulad ng phlegm. Okay.
Yes.
Very good. So, ano po ang sagot niyo po? Yung dalawang window of sky points ng SI.
Yung SI 16 po and 17.
Can you tell us a little more about these points?
So, yung ano po, both tinda, syempre yung window of sky point.
Okay.
Pareho po silang nagdi-dispel ng
Wind.
yung wind and heat. So, para silang nag-clear ng channel.
Okay. So, para makapunta tayo sa heaven, kailangan gamitin. Actually, hindi lang siya ang may window of the sky points na marami pa po. Okay. Very good. What's your answer for number 11, Ma'am Annalyn?
So, for number 10, what are the two, number
Main
11,
point.
Main point for insufficient lactation. So, si SI11, SI1 po.
Okay, how do you needle this? Are you going to
Prick to
needle
bleed
it? It's
lang
so
po
masakit.
siya. Pwede siyang for 3 points. Oo, yung 3 needle.
Ibi-bleed mo?
Yes po, prick to bleed.
Re-edged needle. Have you done this before,
Opo.
Ma'am Annalyn?
Hindi pa, pero pinag-iisipan kong gawin kasi meron akong kilala na problemado talaga sa pagbe-breastfeed kaunti. So, nabasa ko talaga to kanina, yung SI1. Tatlong
Okay.
needle. Opo, yes, prick to bleed lang.
Very good. Great. Okay. Next, the last, I think this is the last question. The senior
Yes
citizen
po.
point.
For arthritis and Alzheimer, the sheet cleft po yung SI6.
Okay.
Yes po.
SI6. Ito ba yung tinatawag nilang nursing the aged? Ito ba? Ano nga yung
Yes
English?
po.
Yeah. Okay. Wow, ang gagaling nyo talaga as in. I'm so proud of you, no? Thank you very much, Ma'am
Thank you po.
Annalyn. Nag-enjoy ka ba dyan?
Yes po.
Are you ready for the
Nag-singit-singit lang pag may time mag-aral. So, ginagawa.
Okay. Kailan kayo mag-e-exam ng ano?
Pag kung kailan naman po
Diagnostic.
makakaluwas, pag merong training. So,
Sige po.
diretso na mag-exam.
Monday na lang. Monday, January or February. Sige, pahinga muna tayo
Opo.
ngayon. And
Opo.
by the
Tsaka
way,
habol-habol.
yeah.
Habol ng lesson.
Sa mukha pa lang ni
Pag-aaral.
Ma'am Annalyn, mukhang enjoy na enjoy siya. Do you feel fulfilled naman?
Po, oo.
So,
Nakaka-enjoy talaga ang TCM.
parang ang dami mo nang ginawang libro dyan, no?
Ito, yung ating reviewer, may picture pa para at least yung location
Wow,
mahanap.
galing.
Pero madami pang pag-aaralan. Pero okay lang.
Oo. So, pwede bang ikaw
Kakayanin.
yung dinala mo last time from Bicol, kumusta na sila? Interested ba?
Ay, opo. Pag-join yung si Tricia sa second batch. So, by
So, we
January.
expect you to teach them
January.
na, ha? Kasi ang galing-galing mo. Turuan mo na sila kaagad para ano.
Ay, opo. Oo.
Alam mo
Nag-aaral muna
naman how
sila
to go
sa
about
mga
it,
video.
diba? So far
Yes
you
po.
have already, I think module 1, we have, do you
Opo.
like our, the flow of our lecture so far?
Yes po, kasi yung din na masyadong mahirap. Sa diagnostic talaga ang mahirap para sa akin.
Actually, yung
So, yan yung
diagnostic
balikan ko,
tuloy-tuloy
yung
eh.
diagnostic. Opo.
Oo. Hindi ka pwede mag-diagnose kung wala ka alam sa pattern.
Yes. Opo. Opo.
Hindi mo
Kaya
rin
doon talaga
maintindihan yung
dapat
pattern
babalik-balikan.
kung wala kang basic. Ganun lang po yun.
Yes po. Opo. Yun yung pinakamahalaga talaga, yung diagnostic, yung module 1 to 3.
So,
So, yun yung babalik-balikan ko.
oo. Next time mag-attend po kayo ng PAAY, about, kasi we're trying to go back to basics, no?
Opo.
Sayang, hindi yata kayo nag-attend last time, or only some of you.
Opo.
Oo, yung ni Dr. Season. So sana po Sige, para tuloy-tuloy na tayo, no? So,
Yes po.
I think that's about it. Did everybody have fun? At least hindi masyadong mahaba, no? Pag hinabaan kasi natin, natutulog na kayo lahat eh. Okay. So, will you be attending our depression? Okay. Can you all attend on Saturday, 5 p.m.? Can you invite friends?
Yes po.
Hindi
For
po siya
depression.
lecture, ha, na all you have to do is just listen. Open video po siya, magsi-sharing po tayo. And I think it's about time that mawala na yung ating shyness. 'Di ba, tinan yung transformation ni Ma'am Angelita. Na-motivate talaga siya ni Dr. Webb. Or baka inspired lang talaga siya. Oh. 'Di ba? So, alam niyo yung pinaka masarap talaga na feeling yung bang yung mga estudyante mo o yung na-train mo talagang magagaling, no? So that means our system is effective. And we hope that you are actually training as trainers. Do you accept the challenge? We're training you as trainers. Okay?
Yes, Doc.
Yeah. Sir AK, are you excited about the program next year?
Very excited, Doc.
Mm.
Very excited ako sa topic na yan kasi napapanahon po yan.
Yeah, ang dami kasing may mga issues ngayon and it seems that parang wala masyadong nag-focus doon, no? Okay, can I hear from Miss Okada, Ma'am Darlene? Ma'am Darlene, nakatulong ba yung ating mga Actually, this is your 37th week, ha? Congratulations. 37th na kasi module 4. One module is 10 weeks. And we are now on module 4, week 7. So that makes it 37 weeks. Okay, sa 37 weeks ba na yon, Ma'am Darlene, did you feel like you were much different from day 1? Paki-unmute po ng mic nyo.
Yes po, Doc. Very helpful and diverse po yung ano natin.
Diverse.
Yung sa dami-dami po ng natutunan.
Hindi ba
I
kayo
think,
nawindang sa dami? Or like, there was a time... Yeah.
Yung sa very overwhelming po nung una, wala ako naiintindihan.
Ay, ouch.
Tapos, pero nung
Paulit-ulit.
yes po.
Makulit
Na
tayo.
doon po na ag-absorb po na ay ganun pala yun, naiintindihan ko na.
So do you see a bright future po, Ma'am Darlene?
Oh yes po, Doc. Very excited for coming
Module 5.
next year. Yes po. Module 5 po.
Okay, ganito po yung ating medical biomedicine natin. So we'll probably start with the clinics by April. At the same time, ang gusto ko kasi mangyari, habang nagki-clinics na kayo, aaralin nyo na yung western side, dahan-dahan, no? Just like the surface anatomy, we will probably deal with that by January or February. I think it will be very easy because most of you familiar na sa mga points, although I haven't seen some of you needle. But I guess basta alam mo lang at para ano yon, di ba? And it's good to hear that you like the system. Thank you po, Ma'am Darlene. Sa itsura mo pala,
Thank you, Doc.
happy ka. Thank you. Let's go to, hindi ko natatanungin si Ma'am Angel kasi si Ma'am Angel parating yan ang una-una kong makikita sa Zoom, pagbukas ko ng Zoom. Nauuna pa yan. And that attitude alone speaks a lot, no? Let's call on Ma'am Lane Arandia. Ma'am Lane, how are you?
Okay lang po, Doc. Good evening po sa lahat.
Good evening. Are there things that we need to change? Kasi magtatapos na po ang taon and I think, magbabakasyon tayo sandali. Do you think you have learned enough? Like, is it easy for you now to embrace?
May improvement naman po, Doc, simula po nung yung from module 1. Unti-unti lang po. Pero kinakailangan pa rin po continuous pa din po talaga yung
Hindi
yung
pwedeng
study.
tumigil, no? Hindi pwedeng tumigil.
Hindi po. Opo, continuous pa din po.
Ang gusto ko kasi
Tsaka hands-on po.
Yeah, just like that style of Dr. Palangka. Ang gusto niya kasi analytical, no? So we'll probably give you more cases. I think for your revalida, it will be mostly cases. Kasi these are the things that you will do. Hindi ito puro yung mga sheet, mga sheet cleft, you know. Okay? You will be given cases, and then although pwedeng mali yung answer mo, but you have to tell us how you will manage the patient based on the history, based on what you see, everything. Okay, so happy naman, Ma'am.
Yes
Ma'am
po, Doc.
Thank you po. Salamat naman. Okay, I will not ask. Yeah, thank you, Ma'am Lynn Galarita, for always pointing out our mistakes. Itong si Ma'am Lynn talagang very, very detailed. Yeah, and we appreciate, no? Na hindi po lahat po tayo dito nag-aaral. Kaya gusto-gusto naming mag-train kasi marami pa rin tayong kulang, no? Yeah. Ay, kumusta na kaya si si Sir Michael? Sir Michael, pwede mo makita yung mukha mo, Sir Michael, kung nag-improve na yung shen mo? Naku, yan. O, diba? Heart na heart imbalance talaga. So, kumusta ka na, Sir Michael?
As of now naman po, nakatulong naman po yung mga
pinagagawa natin.
Kung ang question po yung recent situation ko, all good naman po. Nakatulong din naman po lahat ng mga ginawa sa akin. At inspire naman po talaga kasi na-apply po talaga in myself yung pinagagawa. Okay.
Then may nakita ka bang changes sa dila mo?
From that almost 1 week na po kasi, 1 week na po yung treatment. Hindi pa naman po ganun kabilis, no?
Oo naman, hindi naman, 1 week pa lang.
Sa overnight, oo. 1 week pa lang naman po yung treatment sa akin. Pero I could say naman po mayroong pagbabago sa system. So, thank you po ko doon sa mga nakialam sa akin. Pero salamat po, Doc.
Ganito po whatever things na dinivulge ng patient sa inyo, you should keep it to yourself. Okay?
Opo.
Yan po yung tinatawag na doctor-patient confidentiality.
Confidentiality, yes po.
Huwag niyong kasi alam mo ang narating mo na yung stage na magaling ka pag nagtiwala na sa iyo yung pasyente. Hindi yung tingin sa iyo, nararamdaman ng pasyente yan kung marites ka No? Yung tiwala pa lang, gagaling na yung pasyente. No? So, hindi ka na masyadong depressed, konti na lang.
Konti na lang po.
Do you think
kailangan ko sa work, kaya ganun talaga, sa daily routine, so I need to accept, ganun yung lifestyle ko, so yun lang po talaga dapat lang.
Sige. So maraming salamat daw sa mga nakialam. So, thank you very much everyone. I hope hindi kayo nagulat. Kasi 'di ba, December 7 wala na po tayong Zoom, bakasyon tayo ng 1 buwan. Kasi mukhang hindi natin tumigil sa kazo-Zoom. So instead of Tuesday next week, we're going to have it on Monday, December 4. Madali lang po 'yon, SI and bladder and kidneys, no? Ito po yung we'll probably send it after 2 hours on the group chat. And then please do come on Saturday. Masanay po tayong naka-open yung camera natin. Hindi po ito yung usual lecture na walang nakikinig. We're going to explore why people get depressed, why people who have organ imbalances have depression, and why cancer patients will always have the issue of depression or anger. Bakit interrelated lahat ng emotions, no? And I'm very, very excited because alam ko na intindihan nyo na yung how all the elements are influencing each other. Okay? So maraming salamat po, nakakataba ng puso. I'll see you again on Monday for our assessment. And we hope that you could attend on Saturday, and masanay na po tayo na nakabukas yung camera. Maraming salamat po sa lahat. Good night,
Thank you.
and
Good
stay
night
healthy.
po.
Thank you po. Thank you for your trust. Bye-bye po.
Salamat po.
Bye-bye. Bye po.